Welcome to Healthy Aging Wisdom, where we explore the intersection of natural healing and cutting-edge science to empower your journey toward living longer, moving better, and thinking clearer. Today, I want to start with a question many of us might not ask enough. What's really going on inside our bodies as we age? And how do medical professionals truly perceive these changes? This is not about cynicism or despair, but about uncovering truths that many seniors need to hear. Truths that can transform the way you approach your health, recovery, and vitality. Most people assume aging is a slow, inevitable march toward decline, accompanied by inevitable reliance on medications and symptom management. But here's a natural health insight often overlooked. Your body is designed to heal itself at every stage of life, including well into your senior years. The problem isn't aging itself, but the way mainstream medical culture often misunderstands or undervalues the potential for recovery and resilience in older adults. For instance, take the common reliance on melatonin supplements to aid sleep. While melatonin pill use is widespread, the reality is your pineal gland produces melatonin naturally when conditions are right. What's happening in your body isn't simply a deficit waiting to be patched by a pill, but a system waiting to be supported and synchronized through natural cues like light exposure, nutrient timing, and sleep routines. This topic matters deeply because sleep quality, tissue repair, and cognitive clarity diminish not just due to age but often because of untreated lifestyle imbalances. Seniors in particular face unique challenges: changes in muscle mass, metabolism shifts, and altered hormone patterns that can be managed or even improved when you understand the underlying biology. I want to gently challenge the misconception that aging means inevitable loss and diminished function. Instead, I'll share 5 critical, sometimes uncomfortable truths doctors quietly recognize about older patients. Truths that can reveal new pathways for hope and active well-being. Throughout this talk, I'll explain how your muscle repair happens mostly during deep sleep stages, how chronic inflammation quietly sabotages your body's healing, and why just take your meds often misses the bigger picture of functional health. We'll explore science-backed habits like the power of eating magnesium-rich foods in the evening to enhance relaxation, avoiding blue light before bedtime to improve melatonin synthesis, and timing your intermittent fasting windows to support cellular repair. These aren't quick fixes, they are achievable, natural strategies that work with your body rather than against it. If you care about sleeping deeper, healing faster, and aging with energy, make sure to watch until the end and subscribe so you don't miss the natural wisdom your body is craving. What many doctors understand but rarely vocalize is that cognitive decline is not an inevitable fate sealed by your birth date. The dominant narrative suggests that as you grow older, your brain's ability to adapt and form new connections, a process known as neuroplasticity, diminishes sharply. This belief, while widely accepted, is actually a misunderstanding of how your brain ages. Research shows that neuroplasticity remains active well into your senior years if supported by the right conditions. Your brain's potential for growth and healing doesn't vanish. It only needs the right environment to flourish. What's happening in your body during cognitive aging is complex. The brain's neurons communicate through networks strengthened or weakened by use. Just like a muscle, unused pathways become less efficient. But unlike a fixed system, your brain is dynamic, able to rewire and remodel itself with stimulation, nutrition, and proper rest. One also has to consider the critical role that sleep quality plays here. Deep sleep phases are essential for memory consolidation and clearing neurotoxic waste like beta-amyloid, proteins implicated in cognitive disorders. Unfortunately, many seniors experience fragmented and shallow sleep, which hampers the brain's natural cleansing process. The science is clear: the nutrient tryptophan, found in foods like turkey, pumpkin seeds, and spinach, is a precursor to serotonin, which then converts to melatonin, your brain's natural sleep hormone produced by the pineal gland. Supporting these pathways through diet and lifestyle can enhance sleep quality and cognitive function simultaneously. For example, a practice supported by research is to eat magnesium-rich foods such as leafy greens or nuts with your evening meal. Magnesium calms neural pathways and supports melatonin synthesis, facilitating deeper, more restorative sleep. Furthermore, mental stimulation through activities that challenge the brain, like learning a new skill or meditation, supports neural plasticity. Structured approaches such as combining intermittent fasting, a protocol shown to trigger brain-derived neurotrophic factor, BDNF, a key protein for brain health, with cognitive exercises can foster both cellular repair and improved mental function. You don't need to fight your body, just understand it. Instead of accepting memory loss or brain fog as inevitable, recognize that what's happening in your brain can be influenced by supporting its natural rhythms and healing cycles. If this is helping you see health differently, tap the like button. It helps us reach more people who need this. Subscribe if you're learning something new, because there's more natural healing wisdom to come. One of the ugliest truths clinicians quietly acknowledge is how muscle loss in seniors goes far beyond mere aging. It's largely driven by a chronic, low-grade inflammation that subtly sabotages the body's natural repair mechanisms. This isn't simply the passage of time wearing away muscle like an eroding stone. It's a physiological process that can be influenced and even reversed with the right knowledge. What's happening in your body is that inflammatory molecules, such as cytokines, increase with age in many people, a phenomenon often called inflammaging. These molecules interfere with your muscle cells' ability to repair and grow after activity, blunting the anabolic signals that normally stimulate muscle protein synthesis. The result is a gradual loss of muscle mass and strength, clinically known as sarcopenia, which contributes to frailty and decreased mobility. However, this process isn't inevitable. Functional medicine research highlights that nutrient timing and the quality of what you eat deeply affect muscle health. For example, consuming protein sources rich in leucine, an essential branched-chain amino acid found in eggs, dairy, and lean meats, particularly soon after physical activity, can activate muscle-building pathways. This optimizes muscle repair during periods when your body is primed to respond. Additionally, the timing of meals to align with natural circadian rhythms supports hormone balance, including insulin and growth hormone, which directly influence muscle synthesis. Intermittent fasting protocols, when carefully tailored for older adults, can also reduce systemic inflammation and promote autophagy, a cellular cleanup process that removes damaged components and rejuvenates muscle cells. Alongside nutrition, movement is key. Resistance training stimulates muscle repair and counters the decline in muscle fiber size. Even gentle forms of resistance, like bodyweight exercises or resistance bands, can significantly impact muscle health. The important message is that your muscles retain the capacity to grow and repair far longer than many believe. Practical steps you can begin today include eating a magnesium-rich, protein-balanced dinner about an hour before bedtime to support overnight repair, and reducing exposure to blue light at least 90 minutes before sleep to enhance natural hormone cycles. These habits sync your body's repair mechanisms with your lifestyle. You don't need to fight your body, just understand it and work with these natural processes. If this insight is resonating, please tap the like button. It helps others find this message. Subscribe for more guidance on natural healing and healthy aging. Many older adults reach for melatonin supplements to improve their sleep, believing that natural production is simply lost with age. While it's true that melatonin synthesis decreases, what doctors often see but don't always explain is that this decline is not solely a function of aging. Rather, it's heavily influenced by lifestyle factors that disrupt the pineal gland's natural rhythm. Your pineal gland produces melatonin in response to darkness, regulating your circadian clock and preparing your body for restorative sleep. This is a finely tuned system that depends on proper exposure to natural light during the day and minimal blue light exposure in the evening. What's happening in older adults' bodies often reflects modern habits that confuse this system. Excessive screen time at night, poor nutrient intake, and irregular sleep patterns can all blunt endogenous melatonin production. The physiology behind this is well documented in research. Photoreceptors in your eyes detect light cues that inhibit melatonin synthesis when it's bright and promote it when darkness falls. Blue light, in particular, strongly suppresses melatonin. This explains why artificial light exposure after sunset can dramatically reduce your pineal gland's output. Supplementing melatonin pills doesn't always replicate these natural rhythms and can sometimes disrupt the body's own production over time. Instead, natural protocols can support your body to produce melatonin effectively again. For example, avoiding blue light at least 90 minutes before bed by turning off screens or using blue-blocking glasses resets your pineal gland's sensitivity. Eat magnesium-rich foods such as almonds, spinach, or pumpkin seeds with dinner, which support enzymes involved in melatonin synthesis. Additionally, timing your last meal at least 2–3 hours before bedtime supports circadian regulation and may improve sleep onset. You don't need to fight your body, just understand it. Instead of relying solely on supplements, cultivating habits that align with natural environmental cues lets your body perform its innate function, healing, regenerating, and restoring nightly. If this is helping you reframe your approach to sleep and aging, tap the like button to share the insight. Don't miss out on more natural healing wisdom. Subscribe now. Doctors understand that one of the most fundamental changes occurring as we age happens deep inside our cells, in the mitochondria, often called the powerhouse of the cell. These tiny organelles produce the energy your body needs to function, repair damage, and maintain vitality. What's happening in your body as you grow older is a gradual decline in mitochondrial efficiency and number, which leads to diminished energy production and slower recovery. This decline is a major contributor to fatigue, reduced exercise capacity, and even cognitive slowing. However, this is not a hopeless slide. Scientific studies in functional health and nutrition reveal that mitochondrial function can be supported and even rejuvenated through specific lifestyle protocols. One powerful method involves nutritional ketosis, when the body uses ketones derived from fat as fuel instead of glucose, which has been shown to boost mitochondrial biogenesis, the process by which new mitochondria are formed. Intermittent fasting also triggers cellular cleanup mechanisms called autophagy, helping clear damaged mitochondria so only the healthiest remain active. Your body's cells are designed to heal themselves when given the proper signals. For seniors aiming to feel more energetic, incorporating gentle fasting windows aligned with your circadian rhythm, such as finishing your last meal by early evening and delaying breakfast slightly, can stimulate mitochondrial renewal. Combine this with a diet rich in antioxidants from colorful vegetables and healthy fats, such as omega-3s from fatty fish, which protect mitochondria from oxidative stress, the main cause of their decline. Movement remains equally crucial. Engaging in regular low-impact aerobic exercise like walking or swimming not only improves circulation but enhances mitochondrial density in muscle cells, improving endurance and metabolic health. To support this natural healing, start with practical steps tonight. Prioritize getting to bed before 10 p.m. to align with your circadian rhythm. Limit evening carb intake, and focus on magnesium-rich foods to relax muscles and nerves. And experiment with short daily walks to boost mitochondrial function. You don't need to fight your body, just understand what it requires to thrive even as you age. If this resonates with you, please tap the like button. It encourages others to discover these vital truths. Make sure you subscribe for more science-based strategies to support your natural healing and healthy aging. One of the hardest realities doctors understand about aging is the silent but pervasive role chronic inflammation plays in degrading health over time. What often goes unspoken is just how much low-grade systemic inflammation quietly hijacks your body's natural ability to heal, recover, and maintain function. This inflammation is not always obvious as pain or swelling, but occurs at the cellular level, subtly accelerating tissue damage, breaking down muscle and bone, and impairing brain health. What's happening inside your body is a delicate imbalance between pro-inflammatory and anti-inflammatory signals. As you age, your immune system can become dysregulated, producing more inflammatory cytokines that promote oxidative stress and damage to cells. This state of inflammation contributes to many chronic diseases common in seniors, including arthritis, cardiovascular conditions, and neurodegeneration. The good news rooted in functional medicine is that this process can be managed and even reversed by addressing lifestyle and nutrition in a targeted way. Anti-inflammatory food choices are paramount. For example, omega-3 fatty acids found in fish, walnuts, and flax seeds actively reduce pro-inflammatory markers. Polyphenol-rich foods like blueberries, green tea, and turmeric provide antioxidants that protect cells from oxidative damage. Another powerful tool is minimizing exposure to inflammatory triggers, such as refined sugars, processed foods, and excessive alcohol. Balancing your blood sugar levels through mindful meal timing, such as intermittent fasting strategies, or eating a balanced breakfast with protein and healthy fats, also modulates inflammatory pathways. Alongside diet, quality sleep is foundational. During deep sleep, your body produces cytokines that regulate inflammation and supports repair. Disrupted sleep cycles thus propagate further inflammation and slow healing. Small shifts like reducing blue light exposure in the evening or adding magnesium-rich foods to your dinner can enhance sleep quality and thereby reduce inflammatory burden. You don't need to fight your body, just understand what it's trying to communicate through inflammation. By listening with informed habits, you can reduce inflammation, allowing your body's natural healing to flourish. If this perspective on aging and inflammation is helping you, please tap the like button. It supports spreading this vital knowledge. Subscribe and stay connected to learn more natural strategies for aging with vitality. Older adults frequently experience a healthcare system focused on managing symptoms rather than addressing root causes, a reality that many doctors acknowledge quietly, but seldom speak about openly. What's happening in the body is a complex interplay of systems that are often treated in isolation. This fragmented care can lead to polypharmacy, the use of multiple medications, which sometimes does more harm than good by adding side effects, masking symptoms, or interfering with natural healing. Your body is designed to heal itself, yet in many cases, well-meaning practitioners prescribe medications to control lab numbers or symptoms without fully engaging with functional factors like nutrition, lifestyle, or sleep that drive underlying imbalances. What's missing is an understanding that your health isn't a condition to fix only through pharmaceuticals, but a dynamic process anchored in natural rhythms and cellular renewal cycles. Functional medicine and natural healing perspectives offer a powerful way forward. They emphasize supporting your body's inherent ability to repair through protocols attuned to your physiology. Balancing blood sugar, improving gut health, reducing inflammation, optimizing sleep, and encouraging mindful movement. Intermittent fasting and nutrient timing are examples of protocols that harness your body's innate detoxification and repair pathways, enabling you to stabilize health without reliance on increasing medication load. Many seniors who adopt these habits discover better energy, mental clarity, and physical resilience, alongside fewer medication side effects. This does not mean rejecting medical advice, but augmenting it with empowering self-care grounded in science. It bridges the gap between medical knowledge and what your body needs to thrive holistically. A practical approach to begin includes tracking your symptom improvements while gradually introducing nutrient-dense meals, implementing regular sleep hygiene with blue light avoidance at night, and engaging in gentle resistance exercise to support muscle and metabolic health. Consult your healthcare providers as you progress to ensure safe medication adjustment with professional guidance. You don't need to fight your body. Just understand it deeply and give it what it needs to heal naturally. If this message resonates, please tap the like button to help this wisdom reach more seniors. Subscribe to join us for more insights on natural healing and functional health. As we've explored today, what doctors truly understand about aging is often layered beneath the surface of conventional advice, sometimes uncomfortable but necessary to hear if you want to reclaim your vitality. Your brain's remarkable capacity for renewal continues well beyond youth, especially when you nurture it with quality sleep, targeted nutrition, and mental engagement. Muscle loss need not feel like an unstoppable tide when you support repair pathways through inflammation management, nutrient timing, and movement. Melatonin production declines largely because of lifestyle disruptions, not simply age, and supporting your circadian rhythms through natural light cycles and magnesium-rich foods can restore restful sleep. At the cellular level, your mitochondria can be revitalized by protocols like intermittent fasting, ketogenic nutrition, and gentle exercise, renewing your energy from within. Chronic inflammation, the silent driver of many age-related declines, responds powerfully to anti-inflammatory foods, balanced blood sugar, and quality sleep hygiene. Lastly, the fragmented nature of senior healthcare often overlooks the holistic functional approach your body craves, a chance to reduce medication dependency by embracing natural healing rhythms. Your body is designed to heal itself. You don't need to fight aging as an enemy. Just understand what's happening inside and steward your choices accordingly. The natural tools we discussed are not quick fixes but practical, science-backed habits you can begin integrating today with confidence. Small, consistent steps like adding magnesium-rich leafy greens to your dinner, limiting blue light exposure before bed, engaging in gentle resistance training, and timing your meals to support your circadian clock can cumulatively offer profound shifts in your well-being. I challenge you to try one small change tonight. Perhaps add a handful of pumpkin seeds or spinach to your dinner, and notice how your sleep quality responds. Track this simple habit and celebrate progress. It's the accumulated wisdom of many small wins that leads to powerful transformation. If you found this helpful, let us know in the comments. What will you try first? And don't forget to subscribe and join this journey of natural healing and healthy aging. Your body is ready. You just need to give it what it needs.